The story of enriched flour and its added B vitamins is a fascinating example of how nutrition science, public health policy, and food processing have come together to address a critical gap in the modern diet. At its heart lies the understanding that while refined starches such as white bread, pasta, and rice are convenient and popular, the processing methods used to create them remove a substantial portion of their original nutritional value. Among the most important nutrients lost are B vitamins, specifically thiamine, B1, riboflavin, B2, niacin, B3, and folic acid, B9. These vitamins are essential for energy metabolism, nerve function, and overall cellular health, and their absence from widely consumed staple foods posed a serious health risk, especially during the early 20th century when refined grains became a dietary cornerstone. To counteract this, many governments around the world, including the United States and Canada, introduced mandatory fortification policies beginning in the 1940s. These policies required millers and food manufacturers to add specific B vitamins back into refined flour, creating what we now refer to as enriched flour. This move wasn't just a precaution, it was a direct response to real and widespread health problems. Diseases like beriberi and pellagra, caused by severe deficiencies in thiamine and niacin respectively, were not uncommon in populations that heavily relied on white rice and white bread as dietary staples. These conditions led to neurological, cardiovascular, and dermatological problems that were both debilitating and preventable. Enrichment proved to be a remarkably successful public health intervention. By standardizing the reintroduction of these vitamins into widely consumed foods, the incidence of deficiency diseases dropped dramatically. The strategy was, and remains, particularly effective because it works with foods that people are already consuming regularly. Instead of requiring drastic dietary changes or supplements, fortification quietly restores nutrients that would have been present if the grain had been eaten in its whole form. This makes it one of the most efficient and far-reaching tools in preventive health. The added B vitamins in enriched flour serve critical physiological functions. Thiamine helps convert glucose into energy and supports nerve signaling. Riboflavin assists in oxidative metabolism and cellular repair. Niacin contributes to DNA repair and plays a central role in turning food into energy. Folic acid is crucial for red blood cell formation and preventing neural tube defects during pregnancy. These vitamins are not just additives, they are essential building blocks of health, and their inclusion in enriched flour ensures that even those with less varied diets receive a baseline level of nutritional support. It's also worth noting that fortification policies are not a substitute for eating whole foods, but rather a safety net. Whole grains, legumes, vegetables, and lean proteins naturally provide a broad spectrum of vitamins, minerals, and phytonutrients that work in harmony to support long-term health. Enriched flour helps prevent overdeficiencies, but whole foods offer the full picture of nutrition, including fiber, antioxidants, and more complex synergies between nutrients. Still, in a world where many people rely on convenience foods and refined grain products for a significant portion of their daily calories, fortification remains a practical and compassionate measure to promote public health. What's particularly positive about this approach is how it reflects an understanding of real-world eating patterns. Instead of insisting that everyone overhaul their diet overnight, enrichment acknowledges cultural habits and economic realities, and it enhances everyday foods in a way that is both seamless and effective. The result is a more nutritionally secure population with fewer preventable diseases and a better foundation for lifelong health. As food science continues to evolve, the core idea behind flour enrichment remains a shining example of proactive, science-based health policy. It illustrates how thoughtful interventions can lead to measurable improvements in well-being without requiring constant effort or awareness from the individual. This quiet success story in nutrition continues to benefit millions of people daily, ensuring that even our simplest meals contain the essential nutrients needed to power our lives.